Hi, this is Dr. Kurt Wohler for Autism Recovery System. This video is on low lithium on hair analysis. So nutritional lithium has a lot of interesting benefits. One of the things it does is it helps to stimulate brain stem cell production. Now this can be useful in somebody who's had brain trauma, either from a concussion, for example, or inflammation. So it definitely helps to restore damaged brain cells. It also has a regulatory effect over too much excitatory activity in the brain. So for example, glutamate, which is an amino acid that if too elevated can overstimulate brain cells, and that can lead to stress, oxidative stress, and even damage. What they have found is that lithium also is helpful for things like depression, anxiety, irritability, agitation. I've often found in practice that nutritional lithium used as a supplement can be quite beneficial for some of the behavioral problems that many of the specialists have. Now, there have been studies that have looked at low lithium in water supplies where they have found that in a municipal area where their water supply is deficient in lithium, there can tend to be an increased rate or risk for crime. They've also looked at hair testing with regards to not only kids with autism having low lithium and then behavioral problems, but in mothers with low lithium levels as well, tending to have a higher risk for offspring with autism. And this was just one paper that came out a number of years ago highlighting this. So the hair analysis, and specifically the hair analysis from Great Plains, which is very similar to the hair analysis from Doctor's Data, is a great tool. It's generally easy to obtain as just a hair sample. And it does a pretty good job at analyzing certain minerals. It's not a test that's going to be able to analyze accurately all minerals in the hair compared to what might be found in the blood. But in my experience, it does a pretty good job with regards to minerals like manganese, molybdenum, lithium, selenium, sulfur, and cobalt. Lithium particularly has strong correlation in the hair to what would be obtained nutritionally. So a low lithium level in the hair strongly correlates with a need or a deficiency of lithium. Now, New Beginnings Nutritionals carries a number of different nutritional lithium products. The lithium orotate is a capsule form of nutritional lithium. That's usually used for adults or older individuals, teenagers, for example, who can swallow capsules. But even with that, with many of the special needs individuals, my preference is the liquid lithium, the lithium chloride, and purely because you can dose it 1 drop, 2 drop, 3 drops at a time, so you can titrate the dose much more effectively. And that's useful because there's not an established amount of nutritional lithium based on age or weight. So there's a bit of a ballpark figure of what we're starting with. Typically, most kids are on anywhere between 2 to 5 drops a day. I mean, the website talks about 10 drops for adults, 5 drops for kids. And that's a pretty good rule of thumb, but it's perfectly acceptable to start a little bit lower. One of the things that I've done in practice is I'll give lithium every day for about 30 days. So whether it's 3 drops or 4 drops or 5 drops, I'll have a child do that every day for 30 days, and then I'll start to cycle the dose, meaning I'll move from an every 24-hour dosing to every 48. Whatever program I use, and that one tends to work pretty well. So the first 30 days every day, and then every other day for the additional 60 days. I'll come back and repeat the hair analysis in 90 days. I think it's important to understand that we want to try to get the lithium levels into a normal level, but this is not something that's going to be used forever. So the hair testing is an important thing to repeat, and so I have a general rule of repeating it within 3 months after starting lithium supplementation. Website labtestplus.com. This website carries a number of the labs from Great Plains Laboratory, as well as other labs too. So the hair analysis is obtainable here. And anytime a lab is ordered through LabTestPlus, it comes with a individualized written interpretation as well as what are called action step suggestions based on the markers of the lab test. So you can go to labtestsplus.com for additional information. I'm Dr. Kurt Wohler for AutismRecoverySystem.com. Thank you so much.